I'd like to talk a little bit more about crawling, just because that's, so important.
Sure.
So children can start walking at 9 months, which is at the end of this developmental age. And so some parents will get really excited, like, oh my gosh, my child's walking at 9 months. Although it's not necessarily bad to start walking at 9 months, we want to make sure that they had enough time in crawling. Crawling is so important. Crawling is what connects the two hemispheres, the two sides of your brain. When you crawl, there's crossing midline, like Stephanie has talked about. You get nice weight bearing, so you want to make sure that your child is crawling very symmetrically, means very evenly. That you see when they go here that there's a shortening on this side of the trunk, then when they go the other way there's equal shortening, that they're using their arms equally and their legs equally.
That one leg is not lagging behind.
Exactly. So a lot of parents will say, my child was actually ahead on milestones. I was so excited when they walked at 9 months, but now we're realizing that they have ADHD, or we're seeing that they're having some behavioral issues. They're picky eaters. They don't like certain textures in their clothing. And so really giving your child enough experience on their belly and crawling is so, so vital for normal brain wiring. So you want to make sure that you see that symmetrical crawling, and if you don't, that you talk to your pediatrician and you get in to see a therapist.
The most beneficial or the ideal situation for crawling, honestly, is for a child to go from army crawling, which is on their belly where they army crawl, to 4-point crawling, which we call creeping in physical therapy terms. So those are the two stages of crawling that need to happen in order to integrate our reflexes fully. So if children are not doing both, usually somewhere along the line there's a wiring issue, and we want to make sure that we've assessed that, integrated the reflexes, and if they haven't army crawled, we will sometimes take them back to army crawling. If they haven't 4-point crawled or creeping, we will take them back to 4-point creeping, because if they've missed that stage, it's very important for rewiring and teaching the brain this is how it was supposed to be done. It brings both sides of the brain together, and then they can move forward, and then we don't see some of those social emotional issues that we see at an older age, and we can link them back to, did they crawl, did they not crawl, did they do army crawling and creeping. And research has shown that that 4-point crawling is linked to reading. And so later on you'll see academic issues if those developmental stages were not reached and they didn't spend enough time in those positions and establishing those neural pathways.